Hello, everyone. I would like to welcome you to the 12th session of the European Journal of Cardiovascular Nursing Journal Club. My name is Ekaterini Lambrinou, and I am the current chair of the Council of Cardiovascular Nursing and Allied Professions. I'm very happy today to introduce two of the main authors of the paper you see here. Is entitled Sleep in Octogenarians During the Postoperative Phase After Transcatheter or Surgical Aortic Valve Replacement. We have with us Mrs. Hege Andersen Amofah, who is the first author of the paper, and also we have Professor Tuna Norgundvall from Norway, who are going to describe their research and their paper. I'm here with a couple of my master's students, and this is something I would like to invite all professors to do and be supportive for their students to learn from the journal clubs that this journal provides. So now I would like to ask the first author, Mrs. Hege Andersen Amofah, to give us a brief introduction of their paper.
Thank you, Katarina, for the nice presentation. The focus of this study was sleep in the octogenarian patients in the postoperative phase after transcatheter or aortic valve replacement. As people live longer, aortic stenosis has become a severe cardiac health problem. And without surgical treatment, these patients have a poor prognosis and decreased quality of life. Traditionally, aortic valves used to be replaced with surgical aortic valve replacement, SAVR. However, for patients with severe comorbidities and advanced age, and thereby a higher surgical risk, transcatheter aortic valve implantation, TAVI, provides an alternative treatment. Sleep is also essential for health and well-being, and good sleep restores both psychological and physical energy, which is important for recovery after surgery. Patients having cardiac surgery often complain about poor sleep and experience sleep disturbances during the early postoperative phase, as well as after several weeks. Octogenarians with a high prevalence of preoperative sleep problems constitute a growing group of cardiothoracic surgical ward. It is therefore important to consider that postoperative sleep disturbances can affect mobilization and recovery. The majority of studies on sleep after cardiac surgery have been undertaken in patients undergoing coronary artery bypass grafting. Therefore, the aim of this study was to determine and compare the nature of self-reported sleep and insomnia and recorded sleep-wake patterns in the octogenarians during the in-hospital postoperative phase of the SAVR or TAVI. An observational prospective cohort study design was used. Self-reported data were collected at baseline the day before surgery and daily for 5 postoperative days. We used an actigraph to continually record sleep-wake pattern, starting immediately after surgery through the next 5 postoperative days. The inclusion criteria were aged from 8 years and older, having severe symptomatic aortic stenosis and being accepted for SAVR or TAVI. 143 patients were included in the study. For self-reported sleep, we used Sleep Sufficiency Index, SSE, which was based on 2 items derived from the Uppsala Sleep Inventory. This is an instrument commonly used in sleep studies and older people. The questions were concerning how many hours the patients had slept and how many hours they wished to sleep. And they could answer from 3 hours or fewer and up to 12 hours and more. We also use the Minimal Insomnia Symptom Scale, MIS, to document self-reported insomnia. This self-report tool includes 3 items: difficulties initiating sleep, difficulties maintaining sleep, and difficulties with non-restorative sleep. An ActiWatch 2 actigraph was used to record sleep and wake pattern. The device was placed on the patient's non-dominant wrist and measured the intensity and frequency of the body movement. And the recordings are then analyzed by appropriate software to identify the sleep-wake pattern. Actigraphy is a valid and reliable tool and is reported to have 90% agreement with the polysomnography. But it's easier and less costly to use. And the results. Octogenarians undergoing SAVR or TAVI had a disturbed self-reported sleep and increased insomnia during the postoperative phase compared with baseline. SAVR patients experience most disturbed sleep during the late postoperative phase, for example, from the second postoperative night and later. Actigraphy of sleep-wake pattern revealed that sleep was poor during all postoperative nights, and that the patients slept more during daytime compared with at night. SAVR patients had more disturbed sleep-wake pattern during the later postoperative phase, while the TAVI patients displayed more disturbed sleep-wake pattern on the first postoperative day. And to discuss, to the best of our knowledge, this is the first study to systematically determine self-reported sleep and insomnia with recorded sleep-wake pattern during the complete in-hospital postoperative phase in patients after TAVI. Patients of previous studies experienced the most severe insomnia during the first postoperative night. This is in contrast to the present study, which found that octogenarian patients had few self-reported sleep disturbances and obtained the lowest insomnia score on the first postoperative night. So conclusion, the octogenarians undergoing SAVR or TAVI reported sleep disturbances with more sleep time during the day than at night, but SAVR patients slept more overall than TAVI patients. However, the treatment modalities displayed a different pattern throughout the postoperative phase, as SAVR patients slept more in the early phase, while TAVI patients slept more in the late phase. So implication for practice, both patients after transcatheter aortic valve implantation and patients after surgical aortic valve replacement have documented sleep disturbances following treatment, and treatment of insomnia is a challenge in the early postoperative phase. Organizing interventions to improve sleep, for example, focusing on sleep hygiene with light, noise, temperature, analgesics, availability of nurses, and sleeping routines in order to reduce the time to recovery and length of hospital stay is very important. Nurses should encourage daytime mobilization and provide information on the negative effect of immobility and too much daytime sleeping. The study carries important message for clinical care related to sleep and postoperative mobility, since octogenarians are vulnerable and will need more care than younger patients. Thank you.
Thank you, Hege, for the very nice and short presentation that you gave us about the whole paper, and you also highlighted the important results of your research work. I would like to start asking you something from the design of the study, that you have decided that the population of your survey is octogenarians. How did you focus and why on the particular population? In your introduction, you're saying that most of those people are 70 years old and older. but you have decided to concentrate only to 80 years old. Don't patients 70 years old who are at the same high risk with octogenarians, have you noticed anything different in that particular population that you focused on?
No, I mean the population of octogenarians is a population which has not been studied a lot, and the octogenarians is an increasing population, so that's why this is very important. I think earlier studies has been, when they say older people, the older people is from 65 years and older, and it's a huge gap from 65 and up till 80. So that's why we have to focus from 80 and older.
Yes, you're very right. And I think this is something important with your study, because most of the cohorts, and especially randomized controlled trials, exclude patients who are 80s.
Yes, and also, I mean, the inclusion criteria for the TAVI is being 80 years and older. So that's why also.
Okay. Someone sent a question asking that, have you assessed preoperatively if these patients had sleep problems or insomnia or anything, so you could compare if that had changed after the surgery? Do you know that?
Yes. We measured the self-reported sleep and insomnia. It was recorded at baseline. That was the day before the surgery, and we used the MIS, the Minimal Insomnia Symptom Scale, and the Sleep Sufficiency Index questionnaire. And the postoperative results were compared to the baseline information. Because the patients were included the day before surgery when they arrived at the hospital, and as they were representing a very large geographic area, it was particular difficulties due to actigraph registration before surgery. So that one we only have after surgery, but we have the self-reported sleep and insomnia before.
Yeah, you also say that you had 5 nurses collecting the data. Just to clarify, the same data were collected from 5 persons at the same time?
I don't understand the question.
For the data collection?
No, not at the same time. No, it was the five different nurses who was collecting, being responsible for collecting the data.
Okay, were they trained, these nurses? Did they have an educational program on how to do it, so they would do it the same way?
Yes, they were all, how can you say it? It was all coordinated, and they were trained to do it the same way.
I would also say that you do, yes, have some strange results, like it seems that like the length of stay of the patients who had the surgical valve replacement than TAVI, they had 1 day, almost 1 day longer hospital length of stay than the TAVI patients. Why do you think that was observed? Someone would expect that those who had the surgery would stay longer in the hospital because it's more invasive than TAVI.
Yes, they did. The surgical patients, they stayed longer than the TAVI patients.
Do you have an explanation?
Because it's a bigger operation. The surgical treatment is bigger than the TAVI. Yes, so that's why.
I think the results are saying that the TAVI stayed longer.
No. Where in the paper? We don't say anything about that in the paper.
In the treatment, it says the mean length of stay at the hospital in patient undergoing TAVI was 8.8 days versus 7.9 days after the SAV.
Where can you say where in the paper?
In the 169 page in the treatment procedure, first paragraph, 3 sentences before the end. The mean length of stay.
Yeah, but we have no further comments, and now can we get back to that question?
Okay.
Yeah.
Also, you said that another thing that seems unique coming out is that even though usually the first post-operative day things are having more problems with their sleep, in your study it's shown that the Octogenarians sleep more during the first post-operative day.
Yeah.
Do you think this might have something to do with anesthesia and sedation? I think you commented to your discussion as well. Do you think that something could be?
It might have something to do, but we didn't. We didn't do the analysis for that in this paper, as this was a descriptive paper. But we are working on.
Oh, that's great.
We are now moving further, and we are doing these associations now. So this will be presented in another paper.
Yes, that's good. And I also have a question here asking you if you had also compared the medication that the two groups have taken for their pain control, that this might also had to do with that. I mean, did they take different medication? Because obviously patients who undergo surgery, they may have more pain than the others. Did they? Yeah. And you describe also that they had different sedation, different anesthesia, the two groups.
Yeah, yeah.
So
yeah, the postoperative pain level were measured daily for 5 postoperative days using the VAS scale. And the pain medication is a very, very relevant, and we will include this in our next article. However, we have now done some regression analysis where the VAS and the morphine equivalents were included, and it did provide some interesting results, which will be presented in our next article.
No, that's great. So I'm looking forward for it. You can always seek the Journal of Cardiovascular Nursing for publishing.
Yes, we will.
Expecting that article as well. I would like also to comment another of your important results, that the worst day of sleep disturbances was the 5th day, and I think that was the last day of their staying.
Yeah, no, not last of staying, but the last day of inclusion in the study.
Yes.
Yes.
It's common for the ICU patients to show post-intensive care syndrome and sleep disturbances. Do you think that this might be similar with that after having a few days in an ICU or in a cardiosurgery ward, that they are staying, this could be similar to other ICU or critical care patients, especially for TAVI patients?
Yeah. I think, I mean, it can be different reasons why the sleep was worst in the late postoperative phase. I think, and I think this is different results from earlier studies, because younger patients, they complain about the sleep in the ICU. But what we have seen in some new studies is that older people, they do not complain as much as the younger patients about the sleep in the ICU. So I think this is quite interesting. This is something we have to look on further on. because as I said in the beginning, the octogenarian patients, they are not studied a lot, and they are the increasing population. So, and I think they're not having the same, they don't need the same kind of nursing and treatment as the younger patients maybe, and that's what we have to find out.
Yes,
so
and
that's why this is a very different.
And you commented in your discussion as well, because maybe they feel more secure being in an ICU, taking more closely care. And this is something that as nurses, we should think about when we are having patients, not only in ICUs, but in the ward as well, that they need to feel safe and secure that we can care them well.
I think that's very important.
Yes.
I think maybe the younger patients, they need to be alone, they need to be quiet, but the older people, maybe they need to hear, they need to see, they need more caring.
Yes, and also they feel that they are closer to the death perspective, or their risk is higher. So for them, maybe the feeling of secure is more important for them than the younger people who may be more healthy in general, and the risk is lower.
Yeah.
I think in nursing perspective, this is very important things to see from your paper.
Yes.
Hege, what I would like you to, because we are coming to an end, I would ask you to tell me what is the most important outcome for you coming out from this survey, from this cohort study, and how will you continue this search?
It's a lot of important things, but now we are continuing to work with the sleep, the connection between the sleep and delirium in this patient group, because we did measure the incidence of delirium in both groups at baseline, and the assessment of the presence of postoperative delirium was performed with the confusion assessment method, the CAM, at baseline and for 5 postoperative days. And we also screen the patient for the cognitive impairment at baseline using the mini-mental state examination, MMSE, at baseline. So we have this data, and we will work on with the sleep data and compare them with the delirium data. I think that's very important in this patient group. So that is my work now.
Oh, congratulations. We are looking forward to seeing as well.
Thank you. And I also think one of the important results is also the patients who slept a lot during the daytime. They slept more during daytime that at nighttime. And I think that is a very important result. And as you said, it's important for the nurses working with this patient group. They will need more follow-up with the mobilization postoperatively. So we have a lot to do.
Yes, obviously. And this journal club seems to coming to an end. I would like especially to thank the 2 authors that have been with us presenting their work, their important work. Looking forward for more results of their work. I would like to thank all of you who have sent us questions before this journal club. Hopefully we have answered some of them. If some of you think that some of these questions have not been answered, please email them to the email of the journal club of the journal, and we will send you the answers afterwards. I would also like to thank the people working to the journal in all different positions and in Saga group. Thank them very much, because without them this wouldn't be possible. And I would like to invite more of you to send papers to the Journal of Cardiovascular Nursing, and maybe someday discuss with us your work like we did today. Thank you all, and continue good work. Bye.
Bye.